My name is Nathan. I'm from southeast Melbourne, but I'm here in Mildura for 4th year. There's 6-week blocks of time spent in the hospital here in Mildura. So 6 weeks initially I was on the paediatric rotation and then on the women's, so obstetrics and gynecology, and now on psych. You do get to see a lot of the bread and butter conditions which we need to know to start off with. There's 12 of us all up, so there's 4 students on each of the 3 rotations. That allows you to feel able to approach the consultant or the reg and ask them a question about something you're not sure about. With GP, I had a fantastic time in Maryborough. It was myself and 1 other student, so it was really good because there was lots to do. From day one, it's what's called a parallel consulting model. So you see your own patient, you run the consult as you want, and then the GP comes into the room, reviews the consult with you, make sure you haven't missed anything. They really want to see you learn, they really want to see you extend yourself. You're able to spend more time with each patient. It's really good for just that clinical exposure, assisting with doing excisions and biopsy, so there was a lot of hands-on learning. It's been an excellent supportive environment. The administrative team at Monash has just been really, really lovely. I'm strongly considering doing an internship in a regional setting. My exposure last year in Bendigo and my time here in Mildura showed me that, it's a really nice environment to work in, and those lifestyle factors, so the 5-minute commute or the 4-minute bike ride, the lower living expenses, all of those sorts of things, it just makes it more attractive compared to, say, in the city. You can very easily talk to people and get engaged, finding things that you enjoy doing. I know lots of people join the local footy team or netball, that sort of thing, so there's lots to do, and it's really what you make of it.
My name's Warragul and I'm currently in my 4th year of medicine at Monash University. I'm currently placed at Warragul Hospital, so West Gippsland Healthcare. This year I've decided to come back out to Gippsland, which is where I'm originally from. In Warragul there's currently 6 of us who are on our specialty rotations. Still big enough to sort of form like a study group, but not too big that you sort of get lost. My experience with hospital patients and GP patients has been really, really positive. I relate a lot easier to people from the country and find them a lot more easy to get along with. A typical day for me, I get up about 7 o'clock, have some breakfast, go to the hospital about 8. I might see a patient or 2 in the morning, take a history, do an exam, and then handover starts. And so at handover, you're really more a part of a team. I've found in the country sort of placements, you actually get to hand over a patient in the morning, which is really good. Ward rounds will go for a few hours, and then you might have to go see some patients in ED and clerk them and present them back to the doctor of the day and admit them. In the afternoons, usually tutorials. And then after that, I might go for a run or go to the gym and then cook dinner with my housemates. And then, yeah, it's a typical day. Yeah, it sort of makes you think a lot more than just sort of sitting in the corner of the room. Being in one thaggy for 18 weeks of GP was great. On my 3rd day of GP, I was given my own list each day. So I had 8 patients who would come back and see me, consistently for different things. And it really gives you more of a feel of what it is like to actually do that job rather than sort of sitting and watching or only occasionally seeing a patient every so often. During the warmer months, I'd finish at the clinic and then the beach was only 5-10 minutes away. I'd go for a swim. It takes you 3 minutes to drive to your rotations in the mornings instead of like an hour on public transport. It's just a lot more relaxed and laid back. I'm currently living in Monash accommodation with 3 other medical students. They know the sort of things that you're going through and things that you're seeing, and it's really good for study as well. Being able to form study groups within your house. Occasionally you might cook for each other, which is also handy. The sort of advice I give people if they were thinking of a placement in a regional rural area is just go for it. If you've never been or lived in a regional rural area, you don't know until you try.
My name's Ruby, I'm a 4th year medical student and I'm placed here in Bendigo. I'm originally from Port Fairy, which is like a small coastal town, Western Victoria, but I have lived in Melbourne since I was 15, so I guess I've had the best of both worlds. For this semester, I'm based in Bendigo Health, so I'm spending 6 months here. I've been lucky enough to experience psychiatric medicine, as well as obstetrics and gynecology medicine, and finally I'm on my paediatric rotation, so they're just like 3 of the subspecialties that Bendigo has to offer. Whilst it's an early start, luckily I live 2 minutes from the hospital, so it's a quick drive. The day starts with usually a ward round, or I start with a clinic of sorts. followed by usually a coffee break with the team, which is really nice. In the afternoons, there's usually a clinic, or today I had a paediatric clinic where us medical students run it. So it's a really fantastic learning opportunity where we're supported by the paediatric doctors. And then every evening, Monday to Thursday, we have teaching by the doctors in the hospital. The senior practitioners and consultants at the hospital really get to know you on a personal level and involve you so much in the care of the patients. And you really do feel like a strong part of the team. I did my GP practice in the first half of the year, not in Bendigo, but in Lakes Entrance, which is in Far East Gippsland. Parallel consulting for 18 weeks is such an amazing opportunity to build your confidence as a medical student, see the patient yourself first without the doctor. So you do a full history and examination, kind of run through the patient's concerns, and then you present what you found and discuss with the patient to the doctor. You and the doctor come back to chat to the patient as a together, and I think that's definitely one of the benefits of being rural, is that exposure to one-on-one consulting. So socially, being rural is a fantastic opportunity. Whilst it can be isolating at times, all the fourth year students live in essentially 2 streets. We all live like next door to each other, which is really nice. To hang out on the weekends, get drinks, have dinner. Bendigo has great cafes, great bars. There's a lot less traffic. People are quite friendly and down to earth. We have all the amenities you could want: a lounge room, beautiful kitchen, laundry. Everything you need is right here. And I think it's so important that for some part in your medical degree, have a crack at going rural, because it's just a unique opportunity, and you may in fact love it. Like, it's exposed me to another side of medicine that I couldn't have appreciated from a metro point of view. So now I feel drawn back to here, so I preference it again next year because I just enjoyed it so much.
I've had plenty of friends this year who've ended up with a rural placement. They've really loved it, and a few of them have even said that they're going to come back in the coming years.
It's been a great time for myself to grow, not only in terms of my knowledge from medicine, but just personally. If you are going to spend time rurally, there's no reason why you can't still achieve excellent outcomes whilst maintaining a really excellent lifestyle and just enjoying it.